One of our most exciting missions in many years was to Peru this year, back to South America. We had a very successful trip there last year. This year, we happened to connect with one of the principal healthcare players in that country, Dr. Patricia Garcia.
In April of this year, Ron and other members of the board, including myself, met Patty Garcia at a global public health conference in San Francisco. We came away from that meeting with her intense interest, and within a couple of days had a complete program laid on, including an academic study with members of her department and our 2016 Global Health Fellow, Bianca Marone.
Patricia and our team collaborated on setting up a number of trainings in Lima, and we had the fun of being in the oldest hospital in Peru, Dos de Mayo, and it looked like it was the oldest hospital in Peru. But they were in absolute desperate need of more resources to make their systems work at a 21st century level.
When we arrived at Dos de Mayo, we really didn't know what to expect. We had an initial meeting with all the significant medical directors, and we got a tour of the facility, which is quite old and quite large, but very complete. In some regards, quite modern, and in other regards, quite antiquated. After about an hour of walking around, though, we were just literally ushered into what turned out to be the auditorium that we were going to be doing our presentations in. And there were already 50 to 60 people in there. Our team swung into action. More and more doctors kept showing up. We literally had to shut the door and tell everyone to come back the next day.
The session was really fantastic. People were blown away. And the following day, we went on rounds with Dr. Kiyahara, our primary sponsor there, and they were already using the software on the wards in the clinical area to try to take care of patients. It was really cool to see that. Interestingly, our contact there, Dr. Garcia, who had been working with us, helping us in every way to make all of this work, in the new election in Peru last month, became the Minister of Health for the country. She's now the head health official in the entire country of Peru. Peru is turning out to be a country that I think we caught at the right trajectory of their technological development, of their use of software to assist them in medicine. And also we have the incredible strength of having now the Minister of Health working directly with us and with our team for our sustainability component of the project there.
I think people more and more are using apps and cell phones, and having the information on the palm of their hands, it's going to be really helpful to do what they like to do, which is working with in pediatrics with children and hopefully saving their lives. Yes.
Well, after we left Peru, we went back to our site from last year, Cali in Colombia. And their circumstances, we found, had seriously deteriorated. They have closed the primary university hospital in that town and have cut off basically access to care for a very substantial number of their patients, including thousands of children. The closure of the university hospital brought a massive number of new patients to Club Noel, and they, we found, were in complete overwhelm. We had, however, I think a really good opportunity there to help them once again, but in a slightly different way. We were able to actually put PEMSoft on their computer network, so that the server is going to be spitting out to all of the client computers in the patient care areas PemSoft for use right at the bedside.
The amount of patients coming and also all the different diseases, and mostly in kids, like where you have like kids coming with a lot of signs and symptoms. You need to know what is going on in this PemSoft. That's one of the things that I really thought it was great about the search, and you can put the signs and symptoms and do your differential diagnosis. So I think yes, it's an amazing tool. It would save lives, definitely.
In the chaos that hospital is now witnessing, and the overwhelming circumstance of too many patients, too few staff, and too few resources, I think we've added a very nice dimension for access to really first-class medical information. And they acknowledged that. I think it was probably the strongest piece of that mission this year in Cali.
You doing this for us to be able to help these people, and I think it's a great job, and I think it's an opportunity for everybody to learn, have a tool that it will like save lives, and you can learn also. So I think it's great. Thank you.
Well, one of the best parts of our experience at Dos de Mayo and in Cali this year was being able to see the doctors use the software with patients as we were there. We rounded with them. We saw the kids, severe head injury, uncontrollable seizures, undiagnosable skin infections that we could help them diagnose and manage with the software right now in front of our eyes with the patients right there. It took a lot to make these missions work this year. They were outrageously successful by any standard of evaluation. They have truly changed medical practice in these hospitals where we visited.
Thanks to your support, thanks to be here in our all hospital.
But we know in order to make these missions work that we need the ongoing support of our donor community.
Thank you for supporting this great idea. I think it's wonderful to have the availability in your hands of information that would be key to save lives. So keep funding it. Thank you.
I hope you come back, and we will try to get this thing more people and more colleagues. Thank you very much. The Peruvian child says thank you to you.